Game na, naka-start na.
Start na. Good day, everyone. I'm Pia Magdalene L. Lacarte, the first reporter of Group 1. And today we will talk about Chapter 2, Unpacking the Self. Lesson 1, the physical and sexual self. As part of this subject, GE 101 or Understanding the Self. Learning objectives. Number 1, discuss the developmental aspect of the reproductive system. 2, describe the erogenous zones. 3, explain human sexual behavior. 4, characterize the diversity of the sexual behavior. 5, describe sexually transmitted diseases. And the last one, differentiate natural and artificial methods of contraception. In this chapter, we are going to unpack the self, and one of the topics within this chapter is the physical and sexual self. The following is under this topic. Diseases associated with the reproductive system, erogenous zones, human sexual behavior, physiology of human sexual response, nervous system factor, sexual problems, sexually transmitted diseases, natural and artificial methods of contraception. Introduction. It has believed that the sex chromosomes of humans define the sex, female or male, and their secondary sexual characteristics. So sinasabi na from childhood, we are controlled by our genetic makeup and influences the way we treat ourselves and others. Simula daw pagkabata ay kontrolado tayo ng ating genes at na-impluwensyahan nito kung paano natin itrato ang ating sarili at iba pang tao. However, there are individuals who do not accept their innate sexual characteristics and they tend to change their sexual organs through medications and surgery. So yun, nagpapa-change daw yung iba. Maybe because it is because of the environment. Kasi ang environment can also affect the acceptance of the individual regarding his sexual characteristics. Kung mayroon tayong kakilala or yung mga friends natin na they change their sexual organs, it is because they lack the acceptance of what they have. Pero those changes is okay kasi it is their freedom and for them to better know and understand their selves. Hindi nila matanggap kung ano yung napapunta sa kanila or hindi nila matanggap kung bakit ganoon ang itsura ng kanilang sexual organs. Kaya umaabot sila sa point na ipabago ito or ipa-opera. Kagaya nga ng sabi ko kanina, okay lang naman yun kasi may privilege sila sa kanilang sarili at hayaan lang natin na makilala or maunawaan nila mismo ang kanilang mga sarili. So yun nga, nakakatulong ang ating society at environment sa paghubog ng ating sarili. And this lesson will help us better understand ourselves through a discussion on the development of our sexual characteristics and behavior. Abstraction. The gonads begin to form until the 8th week of embryonic development. Yun. According to Mariev, year 2001, he explains that the gonads begin to form until about the 8th week of embryonic development. When we say gonads, this is the reproductive organs ng isang tao. Testes in the male and ovaries in the female na nagpo-produce ng egg cells at sperm cells. Yun nga, nagsisimula itong mabuo hanggang sa mga 8 linggo ng ating embryonic development. So kapag lalaki ka, syempre, testes ang madedevelop sa iyo at kapag babae ka ay ovary naman. And during the early stages of human development, the embryonic structures of males and females are alike and are said to be in the indifferent stage. When the primary reproductive structures are formed, development of the accessory structures and external genitalia begins. So kapag yung ating reproductive structures ay na-formed, nagsisimula na rin ma-develop yung ating external genitalia. Itong external genitalia, ang mga private part natin. Sa babae ay vagina, at sa lalaki naman ay penis. Yun yung mga tinatawag natin na external genitalia ng isang individual. The formation of male and female structures depend on the presence of testosterone. So alam niyo ba kung ano yung testosterone? Sabi dyan, malalaman mo kung babae or lalaki ka, depende kapag meron kang testosterone. Since ang testosterone ay primary organ ng, or primary sex hormone ng lalaki, sa madaling sabi, lalaki lang ang mayroon nito or lalaki ka kapag may ganito. Usually, kapag nabuo na yung embryonic testes, Yung testes ang magre-release ng testosterone and the formation of the duct system and external genitalia follows. Sa female naman, si ovary ay hindi nagpo-produce ng testosterone. Kaya kapag na-detect na ng duct system na walang testosterone, therefore, ang gagawin ng ating system, pambabae na external genitalia or yung vagina ang mabubuo sa'yo. Any intervention with the normal patterns of sex hormone production in the embryo results in strange abnormalities. So, kapag mayroong intervention sa development ng ating structure, magre-result yan into strange abnormalities. May magiging hindi tama or mali sa atin, lalo na sa ating reproductive organs. For an instance, a genetic male develops the female accessory structures and external genitalia if the embryonic testes fail to produce testosterone. For example daw, lalaki ka, ang madedevelop sa'yo na kasaran ay pang babae. Ito ay dahil nag-failed ang ating embryonic testes na mag-produce ng testosterone. At yun yung nagiging problema dito. On the other hand, if a genetic female is exposed to testosterone, the embryo has ovaries but may develop male accessory ducts, glands, as well as a male reproductive organ and an empty scrotum. So sabi, ganon din dito sa babae, maaaring hindi vagina ang mabuo sa'yo at maging panglalaking reproductive organ. Dito, ang nangyayari, si female ay na-expose sa testosterone kasi maaaring yung mommy ng baby na female or mother ng baby na female ay may tumor na nagpo-produce ng androgen. So, madedetect doon, bakit may testosterone siya, babae naman to. Dito, kahit yung embryo ng babae ay may ovary, ang madedevelop pa rin sa kanya ay panglalaki na organ. Pero empty or walang laman ang kanyang scrotum. Wala siyang sperm cells, ganun. Yan. One of the main or one of the interventions ay pseudohermaphrodites. Pseudohermaphrodites are formed whose individuals having accessory reproductive structures that do not match their gonads. So, di ba yung kanina, ang gonads daw yung reproductive gland natin na nagpo-produce ng gametes na si ovary at testes. So kapag hindi nagmatch ang ating external genitalia doon sa ating gonads, mapapasama ka dito sa tinatawag nating pseudohermaphrodites. Makikita natin dyan sa screen yung picture. Andyan yung babae ka nga, pero mayroon kang penis. Lalaki ka nga, pero mayroon kang vagina. So sa ganitong case, hindi nagmatch ang kanilang reproductive structure sa kanilang gender. Yan, next. Hermaphrodites. Hermaphrodites are individuals who possess both ovarian and testicular tissues, but these conditions are rare. So, rare daw ang ganitong case ng hermaphrodites, wherein sa isang tao, mayroon siyang female at male reproductive organ. Mayroon siyang penis at vagina sa kanya. Yan. Makikita dyan sa picture, himbis na magkaroon ka dapat ng ganito, yung nasa left side na upper, ang nangyari, iba yung nabuo sa'yo. Kung makikita naman natin yung nasa gitna, parang nagmi-meet siya halfway. Like may vagina ka, pero may penis. May penis ka, pero parang hindi naman siya penis. Kumbaga, may abnormalities na naganap sa'yo. Ganon ang nangyayari sa pseudohermaphrodites. May gantong case na dati akong narinig sa TV, magpakailanman yun. Yung babae ay may dalawang organs, pang lalaki at pang babae. Tapos, yun, iniiwan siya ng mga nagiging boyfriend niya dahil sa kanyang abnormality sa katawan. Nowadays, pseudohermaphrodites undergo sex change operations to have their outer selves fit their inner selves. So sa panahon ngayon, yung mga may pseudohermaphrodites at hermaphrodites, sila yung kalimitan na nag-undergo ng surgery or mga operations para mag-fit ang kanilang outer selves sa kanilang inner selves. Ngayon, halimbawa, hindi nag-match yung aking external genitalia sa kung ano dapat ako. Siyempre, dahil ayaw ko ng ganito, ipapa-change ko to. Meron naman ng mga cases na fit naman or tama naman yung kanilang organ, pero since hindi nila matanggap na ganito ang napabigay sa kanila, or ganito yung itsura ng sa kanila, mag-undergo sila ng operation para ma-reach nila or makuha nila yung appearance or organ na kanilang gusto. Kapag hermaphrodites naman, siguro madadali din siya sa operations, pero since medyo advanced na ang technology natin ngayon, mas mabibigyan pa ng chance na maayos yon. siguro kung ano yung mas lamang na organ sa kanya, yun ang ititira at aayusin. A critical event for the development of reproductive organs takes place about 1 month before birth, wherein the male testes formed in the abdominal cavity at approximately the same location as the female ovaries descend to enter the scrotum. So 1 month daw bago tayo ipanganak, ito daw yung pinaka-critical na event sa ating development, especially dun sa ating reproductive organs. Kung saan daw yung male testes ay nagpo-form in the abdominal cavity at approximately the same location as the female ovaries descend to the scrotum. So, ang laman kasi ng ating scrotum ay yung tinatawag natin na itlog. So, ang laman nga ng ating scrotum ay yung testes na tinatawag na itlog. Isang buwan bago ka ipanganak, bababa yung testes at papasok dun sa scrotum. Kaya critical stage to na sinasabi. Kapag ka nagkaroon ka ng abnormalities na ganito, yung hindi nakababa yung ng ayos yung iyong testes, ikaw ay mapapasama sa tinatawag na cryptorchidism. So, cryptorchidism is a condition which usually occurs in young males and causes sterility. That is why surgery is usually performed during childhood to solve this problem. So, yon. Sa case na to, hindi nakababa yung testes sa scrotum ng isang lalaki or sa dapat niyang pagkalagyan. So dahil sa ganitong abnormalities, maaari kang hindi magkaanak in the future. Kaya habang bata pa lang, ginagawa na ng paraan ng mga magulang ng isang bata na masolve ito or maayos through surgery. Kung makikita natin dyan sa picture, ganyan yung itsura ng cryptorchidism. Sa mga boys, kapag may intervention ng inyong mga mommies or yung may mga mali sa kanila or sa inyong mga ina, o kaya nagplano ang mami nyo na ipalaglag kayo, o basta kahit anong nangyari sa kanya na buntis pa lamang at maaaring makaapekto sa inyo, maaaring lumabas na magkaroon kayo ng cryptorchidism kapag ka naging baby na or inilabas na kayo. Abnormal separation of chromosomes during meiosis can lead to congenital defects of the reproductive system. Males who possess extra female sex chromosomes have normal male accessory structures, but atrophy or true shrink of their testes causes them to be sterile. So ano ba itong tinatawag na atrophy? Ito, makikita natin dyan sa pic para mas madali mag-gets. Makikita dyan yung healthy organ at sa kabila naman yung may atrophy. Yung testes kasi, dapat daw ganyan yung size kasi inaalam daw yan or tinitimbang kapag baby ka kung tama ba or may mali sa kanya. So, yung nasa kabila, yan yung may testicle atrophy or mas maliit yung size ng egg niya kumpara sa normal dapat nitong laki. Yan daw, makikita dyan sa picture, mas maliit yung nasa kabila. Other abnormalities result when a child has only one sex chromosome. An XO female appears normal but lacks ovaries. So, yon, an XO female appears but normal but lacks ovaries. Normal siya pero wala siyang ovary. YO males die during the development. Other much less serious conditions also affect males primarily such as phimosis. So itong phimosis, it is another abnormalities na maaaring mangyari sa isang lalaki usually kapag bata pa din daw ang bata. Bata pa din nga ang baby. So phimosis, this is due to a narrowing of the foreskin of the male reproductive structure and misplaced urethral openings. Makikita natin dyan sa screen yung normal penis at yung may phimosis. Dyan sa may phimosis, hindi natin makikita yung glans or yung pinakaulo ng penis kasi masyadong makapal ang foreskin na nandito sa labas. So parang ang ganitong case ay kalimitan sa mga bata pa or doon sa mga lalaki na hindi pa natutulian. Yan. The male and female reproductive system. Yan, nakikita natin dyan sa picture yung main reproductive organs ng male at ng female. Sa female, makikita natin dyan yung vagina, uterus, fallopian tube, cervix, at saka ovary. Sa male naman, makikita natin dyan yung testes, epididymis, vas deferens, prostate, and seminal vesicles. Puberty. It is the period of life generally between the ages of 10 and 15 years old. when the reproductive organs grow to other adult size and become functional under the influence of rising levels of gonadal hormones. So, when puberty hits you daw, we are about to 10 to 15 years old. So, kapag sa babae, ang ganito, nade-develop na yung reproductive organ or dumadating na sa point na lumalaki na daw yung size nito. So, after this time, reproductive capability continues until old age in males and menopause and in females. So, pagkatapos ng puberty, ang reproductive capability natin ay tuloy-tuloy hanggang tumanda ang lalaki at ma-menopause ang babae. So, in males, as they reach the age of 13, puberty is characterized by the increase in the size of the reproductive organs, followed by the appearance of hair in the pubic area, axillary, and the face. So, sa lalaki naman, usually, lumalaki or lumalalim ang kanilang mga boses. Nagsisimula na rin mag-appear yung mga facial hairs nila. Sabi dito, kapag boys, nag-start na din lumaki yung kanilang organs, yung kanilang balls or kanilang penis. Kumbaga po ay kapansin-pansin na daw ang pagbabago ng size nito. Sabi, humahaba or medyo tumataba, ganoon. Nagkakaroon din ng hair ang kanilang pubic area. The reproductive organs continue to grow for 2 years until sexual maturation mark the presence of mature semen in the testes. Next. Yan. In females, the budding of their breasts, usually occurring at the age of 11, signals their puberty stage. Menarche is the first menstrual period of the females, which happens 2 years after the start of puberty. Hormones play an important role in the regulation of ovulation and fertility of females. So, yan, at the age of 11 daw, pagdating sa babae, nade-develop yung kanyang breast. Kumbaga, ay lumalaki na siya. At kapag nag-start na lumaki yung breast ng isang babae, after 2 years daw, magsisimula na rin silang magka-period. Tapos, magsisimula na rin silang magkaroon ng hair sa mga body parts or sa mga area na dapat ay mayroon nito. May ilan na hindi naman agad tinatamaan ng puberty o late yung kanilang ganitong happening sa kanilang katawan. So, hormones play an important role in the regulation of ovulation and fertility of females. So, bakit sinasabi na mahalaga yung hormones? Kasi itong hormones, ito magsasabi kung ano ang mga nafe-feel natin. Or, kasi di ba minsan mahirap i-view ang ating sarili. Minsan, sobrang saya natin, madaling magalit, masyadong malakas kumain. So, ganun yung ating mga hormones na hindi natin alam ay dahil pala doon. Kalimitan nito ay sa mga babae kapag nagkakaroon sila ng period. Kasi, ang hormones daw ang nagre-regulate ng ating ovulation. Next po. Diseases associated with the reproductive system. Infections are the most common problems associated with the reproductive system in adults. So, infection daw ang pinaka-common na problem associated with our reproductive system sa ating mga teens or kahit doon sa mga babae na matatanda na at may asawa na. Yan. Vaginal infections are more common problems in young and elderly women in those whose resistance to diseases is low. So, vaginal infections are more common problems in young and elderly women. Ang nangyayari sa ating mga teens daw, sa ating mga babae, vaginal infections daw ang pinaka-common na dumadating na diseases. The usual infections include those caused by Escherichia coli or which spread through the digestive tract. Sexually transmitted microorganisms such as syphilis, gonorrhea, and herpes virus. So yon, Escherichia coli. Ito daw yung coli na magi-spread or kakalat sa ating digestive tract. Most strains naman daw ng E. coli ay harmless. Pero di may iwasan na yung iba ay makasakit sa'yo or magdulot ng sakit sa'yo. At saka, yung E. coli daw ay kalimitan ay tumitira sa ating large intestine or dun sa bituka natin na malaki. Dun siya na tumitigil. Yung about naman sa syphilis, gonorrhea at herpes virus ay didiscuss mamaya ng ka-group ko. Malalaman doon kung ano ba yon or kung ano ba yung maidudulot nito. Next. Yeast or a type of fungus. Vaginal infections that are left untreated may spread throughout the female reproductive tract that may cause pelvic inflammatory diseases and sterility. Problems that involve painful or abnormal menses may also due to infection or hormonal imbalance. Makikita natin dyan sa screen. Yung yeast daw ang pinaka-common type ng vaginal infection na mangyayari sa private part ng babae. Kung makikita nyo dyan sa vagina, nagkakaroon ng mga color white yung private part. Yan yung tinatawag natin na yeast na nagdudulot ng irritation, discharge, at saka pangangati or itchiness ng vagina. So, yung vaginal infections daw na hindi ginagamot or hindi pinapagamot ay maaaring lumalapa or mag-cause ng pelvic inflammatory diseases. Kaya kung may mga infections, syempre, huwag nating babaliwalain or ipagamot agad natin dahil baka makasama na pala ito. So, last. Yung mga pananakit daw ng ating mga puson ay maaaring dahil din sa infection or sa hormonal imbalance natin. In males, the most common inflammatory conditions are prostatitis, urethritis, and epididymis, all of which may follow sexual contacts which sexually transmitted diseases or STD, microorganism are transmitted. Sa mga lalaki naman, ang most common na mga inflammatory conditions ay iyong prostatitis, urethritis, at epididymis. At yung mga nabanggit daw po ay maaaring sumunod sa sexual contract or kapag nakikipagtalik kung saan na ipapasa or nahahawaan ng isang lalaki ang isang babae ng diseases. Orchiditis or inflammation of the testes is rather uncommon but serious because it can cause sterility. It commonly follows mumps in an adult male. So, yung orchiditis ay bihira lang pero seryosong case dahil nagdudulot ito ng sterility. Kapag ganito, sinasabi na you are unable to produce a child. Kumbaga, hindi ka magkakaanak kapag may ganito. Pero kapag matanda ka na naman, hindi naman ibig sabihin na kapag may mumps ka or may orchiditis ka, hindi ka na magkakaanak. At yung sinasabi pala na mumps, yun yung bayeke or beke na umaano sa ating mukha. Neoplasms are a major threat to reproductive organs. Tumors of the breast and cervix are the most common reproductive cancers in adult females, and prostate cancer is a widespread problem in adult males. So, yung neoplasms daw ay major threat sa ating reproductive organs. Bakit? Dahil yung mga tumors na yan at cervical cancers ay mahirap daw gamutin. Kung magamot man, ay bumabalik din. Yung breast tumors at saka cervical cancers ay para sa mga girls or sa mga babae, at kapag sa boys naman, ang ikinababahala po nila ay yung prostate cancer. Most women hit the highest point of their reproductive abilities in their late 20s. Yon, sa babae daw, ang highest peak daw ng ating reproductive abilities ay in our late 20s. O age na 26, 27, 28, at 29, ganon. A natural decrease of ovarian function usually follows, characterized by reduced estrogen production that causes irregular ovulation and short-term menstrual periods. So, ang pagbaba daw ng function ng ovarian ay kadalasang sinusundan ng pagbabawas ng produksyon ng estrogen na nagdudulot ng hindi regular na ovulation o paglalabas ng egg cells at mas maikling pagreregla. Ovulation and menses stop entirely, ending childbearing ability. So, kapag nag-stop na ang ating regla at paglalabas ng egg cells, hindi na tayo or hindi na magkakaanak ang isang babae. At ang event na ito ay tinatawag nating menopause, which occurs when females no longer experience menstruation. So, ang tawag daw natin dito sa event na ganon ay menopause or yung pagtigil ng ating ovulation at pagreregla. Ito daw ay nag-occur mostly sa mga babae na 45 years old pataas. There is no counterpart for menopause in males. Although aging men show a steady decline in testosterone secretion, their reproductive capability seems unending. Healthy men are still able to father offspring well into their 80s and beyond. So, wala raw menopause ang mga lalaki. Ang mangyayari lang, wala na raw lalabas na testosterone sa lalaki dahil nagde-decline na or dahil tumatanda na ang isang lalaki. Pero hindi naman daw ibig sabihin na sinabi natin na magde-decline na ang testosterone ay hindi na magkakaanak ang lalaki kapag siya ay matanda na. Dahil kahit daw nag-decline na ang testosterone, posible pa rin magkaanak or makabuntis ang isang lalaki kahit siya ay 80 years old na, ganun katanda. So yon, healthy men are still able to father offspring well into their 80s and beyond. Yun nga, ang mga healthy daw na lalaki, kahit 80 years old na or lolo ka na, pwede ka pa rin maging tatay or pwede ka pa rin makabuo ng bata. Next po ay erogenous zones. Erogenous zones. Erogenous zone refer to parts of the body that are primarily receptive and increase sexual arousal when touched in a sexual manner. Some commonly known erogenous zones are the mouth, breast, genitals, and anus. Erogenous zone may vary from one person to another. Other common areas of the body that can be aroused easily may include the neck, thighs, abdomen, and feet. So ano ba yung erogenous zones? Ang erogenous zones daw ay yung mga body parts natin or mga kapag ay hinahawakan na parte ng ating katawan ay nagpapataas ng ating sexual na pagpukaw or parang nakakapagpataas ng ating libido, ganon. Yung mga commonly known na part na daw po nito na kapag hinahawakan ay nakakapagpataas ng sexual arousal ay breast, mouth, tsaka yung private parts natin. Sabi, nakadepende din daw sa isang tao kung saan ba talaga yung erogenous zone niya. Pero kalimitan nga ay doon sa mga nabanggit ko na parts. At yung iba pong parts na maaari pang makapagpataas ng ating sexual arousal ay yung ating leeg, tenga, ating tiyan, at saka paa daw. Pwede din daw yun. So, next reporter na po. Next reporter na po.
Human sexual behavior. Human sexual behavior defined as any activity solitary between two or more in a group that induces sexual arousal. Uh, in short po, ang human sexual behavior ay any activities na ginagawa solo or with someone that makes them sexually turn on, or any activity na ginagawa solo man or between two or more in a group na nakaka-horny. Next. ano, two major factors that determine human sexual behavior. Number one ay inherited sexual response that patterns that have an involved as a means of ensuring reproductive and that are a part of each individual genetic inheritance. Inherited sexual response patterns, parang ano, kung kung paano nagre-response ang isang tao sexually based sa genetic inheritance. Ganon. Number two ay ano, degree of restraint. Other types of influence exerted on the individual by society in expression of sexuality. Meaning ay kung degree of restraint. Kung paano kung anong epekto ng society sa isang tao in terms of sexuality. Ganun. Kung paano na-impluwensyahan ang isang tao in terms of sexuality. Next po. Types of behavior. Solitary behavior. Self-gratification means self-stimulation that leads to sexual arousal and generally sexual climax. Yung tinatawag na pagmamasturbate, ganun. Self-gratification takes place in a private as and in itself, but can also be a socio-sexual relationship. Yung self-gratification, pagbibigay kasiyahan sa sarili, it usually end itself. Ganun. Self-gratification. Self-gratification begins at or before puberty. Is very common among young males but becomes less frequent or is abandoned when socio-sexual activity is available. Di ano, this explains itself naman na nagle-lessen when you are in a relationship wherein you cannot do it alone anymore. Self-gratification is most frequent among the unmarried. Siyempre, mga ano, hindi kasal, mga single or not in any relationship. There are more males who perform acts of self-gratification than females. Mas common to sa mga lalaki. Pero may pangilan-ngilan din namang gumagawa na babae. Nowadays, humans are more frequent being exposed to sexual stimuli, especially from advertising and social media. Some adolescents become aggressive when they respond to such stimuli. The rate of teenage pregnancy is increasing in our time. The challenge is to develop self-control in order to expression. Adolescents need to control their sexual response in order to prevent premarital sex and acquire sexually transmitted disease. Next po. Yeah. Sociosexual behavior. Heterosexual behavior is the greatest amount of sociosexual behavior that occurs between only one male and one female. Ano, literal na babae at lalaki lang, no more no less. It usually begins in childhood and may be motivated by curiosity, such as showing or examining genitalia. When we were young, syempre, ano, curious tayo sa lahat ng bagay including our reproductive organ itself. That's the start. Physical contact involving. Sana yan? Physical contact involving necking or petting is considered as a ingredient of the learning process and eventually of courtship and the selection of a marriage partner. Petting. Sana yan? Petting. Petting. Pa-next po nung ano, slide. Coitus. Coitus. The insertion of male reproductive structure into female reproductive organ. Yung pagpasok ng nung lalaki sa babae, yung manhood ng lalaki sa vagina ng babae, ganun. View by the society, coitus tawag doon. View by the society differently upon the marital status of an individual. Premarital coitus, more likely to be tolerated but not encouraged in the such individuals intent marriage. Premarital sex, having sex before marriage. Nauna yung sex kaysa sa marriage. Premarital coitus daw. Extramarital coitus involving wives of generally condemned and if permitted is allowed only under exceptional condition or with specified person. More than two including your partner. Oh, mahirap yon. Postmarital coitus. Coitus by separated divorced or widow person is almost always ignored kapag mga hiwalay na or namatay asawa, ganun. Postmarital coitus tawag doon. A behavior may be interpreted by society or individuals as erotic, capable of engendering sexual response, depending on the context in which the behavior occurs. The apparent motivation of the behavior greatly determines its interpretation. Next po.
Psychology of human sexual response. Human sexuality is the expression of sexual sensation and related intimacy between human beings. Psychologically, sexuality is the means to express the fullness of love between man and woman. Ang human sexuality daw po ay pinapakita ang expression kaso related ang intimacy. At sa human sexuality din daw po ay pinapakiramdam mo sa tao kung gaano mo siya kamahal. Human sexuality is the way people experience and express themselves sexually. This involves biological, erotic, physical, emotional, social, or spiritual feelings and behavior. The sexual response cycle has 4 phases: excitement, plateau, orgasm, and resolution. Both men and women experience these phases, although the timing usually is different. For example, it is unlikely that both partner will reach orgasm at the same time. Meron daw pong 4 phases during or habang nagse-sex. Yun daw po ay excitement, plateau, orgasm, and resolution. Ipapaliwanag ko po sa next slide. Next. Excitement phase. It is caused by increase in pulse and blood pressure. The body prepares for sexual activity by tensing muscle and increasing heart rate. In the male, blood flows into the penis, causing it to become erect. In the female, the vaginal wall becomes moist and the inner part of the vagina becomes wide. Sa excitement phase po, ay parang magpe-prepare yung katawan mo para sa magaganap na sex at sa lalaki daw po, pag nagpe-prepare, ang penis daw po ng lalaki nagiging nalaki, kumbagay erect. Sabay sa babae naman po, yung vagina daw po ay nagiging moist, tapos po ang inner part daw po ay lumalaki. Plateau phase. It is generally of brief duration if stimulation is confused. Orgasm usually occurs. Plateau follows the excitement or sexual arousal phase and is characterized by increased heart and respiratory rates, increased sexual pressure, increased muscle tension, and is followed by orgasm. Ang plateau phase daw po, kung sa excitement, nag-prepare ka lang para sa mangyayari na sa plateau phase. Sa plateau phase naman po nangyayari na yung sex at doon naman po anong tag doon, yung nagaganap na po yung stimulation nyo at pwede na yung yung orgasm. Next slide po. sexual feeling. It is marked by feeling of abrupt, intense pleasure, a rapid increase in the pulse rate and blood pressure, and spasm of the pelvic muscle. Dito naman po ay parang nangangalay na yung iyong mga muscle, gawa ng nagaano na po yung inyong mga spasm. Ang spasm po is para pong nangingisig. Sa sobrang tagal po nung nangyayaring sexuality. Resolution phase. It is the last stage that refers to the return to a normal or subnormal psychological state, whereas males return to a normal even if stimulation continues. But continue stimulation can produce additional orgasm in females. Ito naman po yung last stage kung saan po patapos na. Kahit po nang lumabas na po yung orgasm, tapos po yung lalaki po lalabasan na po ng sperm cell, pwede pa rin po ring maglabas po pag kinontinue po yung stimulation. Next, reporter.
Nervous system. Nervous system factor. Why is the nervous system the most important system our body and how it relates to self-unpacking? Next po. We all know that nervous system controls each prepare within the body. It can invigorate tissues to deliver hormones and proteins, let's say in reproductive system. It interacts with other body system. The entire nervous system plays a significant role during role during sexual response. The autonomic system is involved in controlling the involuntary responses in the presence of a stimulus capable enough in initiating a sexual response. The efferent cerebrospinal transmit the sensory message to the brain. Mahalagang papel na ginagampanan ng nervous system sa panahon ng sexual na reaction, kabilang sa pagkontrol ng autonomic system sa mga hindi kailangang reaksyon. Upang simulan ang isang sexual na reaction, kailangan ng isang stimulus na may sapat na kakayahan. Nagpapadala naman ang mga paggalaw ng mensahe sa utak, efferent cerebrospinal. Next po. The brain will interpret the sensory message and dictate what will be the immediate and appropriate response of the body. After the interpretation and integration of sensory input, the efferent cerebrospinal nerves receive commands from the brain and send them to the muscle, and the spinal cord serves a great transmission cable. Madidikta naman ng utak kung anong magiging tamang reaksyon ng katawan pagkatapos ng interpretasyon, at pagsasama ng sensory input ay tumatanggap naman ng efferent cerebrospinal nerves ng mga mensahe mula sa utak at ipinapadala ang mga ito sa mga kalamnan, at ang spinal cord ay nagsisilbing isang mahusay na transmission cable. The hypothalamus, the muscle contract response, the signal coming from the motor nerve fibers, while glands secrete their respective products. Hence, sexual response is dependent on that activity of the nervous system. Ang mga kalamnan ay kasundo ng bilang reaksyon sa signal na nagmumula sa mga fibers ng motor nerve fibers, habang ang mga glands ay naglalabas ng kani-kanilang mga produkto. Sa makatuwid, ang sexual na reaction ay nakasalalay sa aktibidad ng nervous system. The hypothalamus and the limbic system are the parts of the brain believes to be responsible for regulating the sexual response, but there is no specialized sex center that has been located in the human brain. Ang hypothalamus at ang limbic system ay ang mga bahagi ng utak na pinaniniwalaan ng responsable para sa pagsasaayos ng sexual na tugon, ngunit walang espesyal na sex center na matatagpuan sa utak ng tao. Next po. Animals experiment shows that each individual has coded in its brain two sexual response patterns. One is for mounting masculine behavior and one for mounted feminine behavior. Sex hormones can intensify the mounting behavior of individuals. Normally, one response pattern is dominant and the other latent can still be initiated when suitable circumstances occurs. The degree to which such innate pattern exists in human is still unknown. Base sa eksperimento, sa mga hayop ipinapakita dito ang bawat individual ay may nakakode sa utak nito ng dalawang pattern ng reaction sa sexual. Ang isa ay para sa pag-mount. Ito ay sa mga lalaki na pag-uugali at isa para sa nakamount, pambabae na pag-uugali. Maaring patindihin ng mga sex hormone ang mounting behavior ng mga individual. Karaniwan dito, nangingibabaw ang isang pattern ng reaksyon at ang isa pang nakatago ay maaari pa ring simulan kapag may angkop na pangyayari. Ang antas kung saan umiiral ang sinasabi sa tao ay hindi pa rin alam. Apart from the brain control sexual response, there is some reflex sexual response. This reflex is mediated by the lower spinal cord and leads to the erection and ejaculation for male, vaginal discharge and lubrication for female when the genital and perineal areas are stimulated, but still the brain can overrule and suppress reflex activity, as it does when the individual decides that a sexual response is socially inappropriate. Bukod sa sexual na reaksyon, nakontrolado na ang utak ay mayroong ilang reflect na sexual na tugon. Ang reflect na ito ay pinapamagitan ng lower spinal cord at humahantong sa paninigas at ejaculation para sa mga lalaki. Mga discharge at pagpapadulas para sa babae kapag ang mga bahagi ng ari at perineal ay pinasiglang ngunit gayon pa man, ang utak ay maaaring mawalang bisa at labanan ng reflect na aktibidad tulad ng ginagawa nito kapag ang individual ay nagpasya ng ang isang sexual na reaction ay hindi naangkop sa lipunan. Next po. Next reporter.
Good day to all of you, as well as you, Ma'am Liza. So, I am Don Christopher Mbaet, who will report about the sexual problems and sexually transmitted diseases or STDs. So, ano nga ba pag sinabi nating sexual problems? Sexual problems is difficult to experience by an individual or partners during any stage of normal sexual activity, including physical pleasure, desire, preference, arousal, or orgasm. So, yung sexual problems na yan is, ano, na-encounter yan ng mga mag-asawa and pwede rin sa mga individual. Ayan. Yung sexual problems is maaari mo siyang, based on my own opinion, maaari mo siyang ma-adapt sa iyong relatives or mga magulang. Yun lang po ay based lang sa aking opinion. And yung sexual problems naman po is pwede naman po siyang magamot kung tayo po ay lalapit sa mga eksperto o mga doktor na kung saan is kayang gamutin. And yung sexual problems is hindi mo po siya kaagad-agad na 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 nalalaman dahil po sa yung sexual problems po is parang ano, sa paedad po, sa pagtanda mo, mas nade-develop po yung sexual problem. Ayan. So, next slide po. So, ayan. Yung sexual problems po is may be classified as physiological, psychological, and social in origin. Ayan. In any given problems po ay maaari pong involved from all three categories. So, ano nga ba yung physiological problems? The least among the three categories. Yung physiological problems po is bilang lang po yung mga taong nagkakaroon yan. Yung mga nagsasuffer po from diseases that are due to abnormal development of the genitalia or the part of the neurophysiology controlling sexual response include vaginal infection, retroverted, uterine, prostatitis, adrenal tumors, diabetes, senile changes of the vagina, and cardiovascular problems. Ayan. Yung diabetes po, meron po kami ng ano, may lahi po kami ng ganyan. So, kaya po ako nag-iingat sa mga matatamis na pagkain. Ayan. Ang physiological problems po is karamihan ng mga problema sa physiological sexual ay maaaring masolusyonan sa pamamagitan ng gamot o operasyon habang ang mga problema ng nervous system na maaaring nakaapekto sa sexual na tugon ay mas mahirap gamutin. So, next slide po. Physiological problems comprise by far the largest category. They are usually caused by socially included inhibitions, maladaptive attitudes, ignorance, and sexual needs held by society. Ayan. Yung physiological problem po are emotional and psychological being is vitally important to our sexual well-being. In any kind of psychological or emotional stress po ay maaari pong mag-cause ng sexual dysfunction. Even po na hindi po tayo mag-suffer from a medically diagnosed mental condition. The psychological causes of this sexual dysfunction po ay marami po and iba't iba po. Premature emission of semen is a common problem, especially for young males. Yan. Yung mga karaniwang problema po sa semen, especially po sa mga kabataang lalaki. So, erectile impotence. Ano nga ba yung erectile sa Tagalog? Yan po yung parang paninigas. Yan. Word paninigas po, parang yun po ay para sa mga lalaki laang dahil sa mga lalaki po ay nanindigas po kahit wala pong buto dahil po sa muscle. Yan. So erectile impotence is almost always of psychological origin in males under 40. Yan. 40 po pababa. Fear of being impotent frequently causes impotence, and in many cases, the afflicted male is simply caught in a self-perpetuating problem that can be solved only by uh, achieving a successful act of coitus. Yung erectile impotence po is type po ng sexual dysfunction in which the penis fails to become or stay erect during the sexual activity po. Yun po yung pagtatalik. So, next ano po, slide. Ejaculatory impotence, which results from the inability to ejaculate in coitus, is uncommon and usually of psychogenic origin. It appears to be associated with ideas of contamination or with memories of traumatic experiences. Yan. Yung ejaculatory impotence po, ang mga lalaki po ay nakakamit ng isang erection para hindi maaaring maabot yung orgasm sa vagina ng babae. Kaya ang pag-iingat po ay maaaring panatilihin for long periods, even long after the female partner has achieved. Yeah. So vaginismus is a strong spasm of the pelvic musculature constricting the female reproductive organ so that penetration is painful or impossible. So yung vaginismus po is ito ay madalas na resulta sa sakit na may mga pagtatangka sa sex. Na kadalasan po is ito ay nagsisimula kapag ang sex ay unang sinubukan. At ayang vaginismus po ay ang cause po niyan is yung extreme stress, negative reactions towards stimulation of sex, anxiety, lack of trust in the denied sexuality. Yung vaginismus po ay para lamang sa mga babae. Ayan. Next slide po. So, ayan. Sexually transmitted diseases. Next slide po ulit. So, ano nga ba yung sexually transmitted diseases or STDs? Yan po yung infections transmitted from an infected person to an infected person through sexual contact. Ayan. Yung STDs po or sexually transmitted diseases can be caused by bacteria, viruses, or parasites. Ayan. Example include gonorrhea, genital herpes, human papillomavirus infection, human immunodeficiency virus or HIV, acquired immunodeficiency syndrome, or AIDS, chlamydia, and syphilis. So yung sexually transmitted diseases po, yan po ay from uninfected person to an uninfected person. Ayan. So, yung sexually transmitted diseases po, ang halimbawa po niyan is yung isa po akong empleyado sa isang kumpanya. Tapos yung trabaho ko po is humiram ng tumbler sa akin or yung inuman ng tubig. Hindi niya po alam or hindi po alam ng lahat na meron po akong HIV. Example lang po yun Baka po masabi niyo na may HIV ako. Ayan. So, ang ginawa niya po, humiram po sa akin dahil nga po hindi niya po alam na meron po akong HIV. So, pagkahiram niya po, hindi uminom po siya. So, yung HIV pong yun or yung virus na yun is hahawa po sa kanya. From infected person, ako po yung infected person, to an uninfected person. Siya po yung uninfected person, which is ano po, magiging infected person na po siya kasi po hiniram niya po yung tumbler ko na which is ano po, meron po akong HIV. Ayun. Kahit anong oras po ay or ilang seconds po ay maaari na po siyang maging infected person bilang isang merong HIV. STDs are significant global health priority because of their overwhelming impact on women and infants and their relationships with HIV and AIDS. STDs and HRV are associated with biological interactions. The virus survives throughout the body but may be transmitted via body fluids such as blood, semen, vaginal fluids, and breast milk. So, excuse me po. Ganun po kadaling makasurvive yung virus na yon. At hindi po ganun basta-basta mawawala yung virus na yon. And nga po pala, ang COVID-19 po ba is mako-considered natin bilang kasama sa sexually transmitted diseases. So, ano po siya? Kasama po siya sa STDs or sexually transmitted diseases dahil isa po siyang virus. Ayan, kasi nakalagay po dito, STDs can be caused by bacteria, viruses, or parasites. Kaya po na-considered po na kasama sa STDs yung COVID-19. Halimbawa po, meron po akong girlfriend kahit wala po. Example lang po. Meron po akong girlfriend. Okay. Niyaya ko po siya magtalik. Hindi niya po alam na meron po akong COVID-19. So, may virus po ako. So, nung niyaya ko po, nakipagtalik po ako, ayun po, magkakaroon na rin po siya ng COVID-19 or virus dahil hindi niya po alam na meron po akong virus, which is ako po yung infected person at siya po yung uninfected person na kung saan po is magiging infected person na po na mayroon na rin po siyang COVID-19. Kasi po, yung virus, ganun po kadaling makahawa sa ating kapwa-tao. Ayan. Next slide po. So, ayan. The following list of diseases is based on sexually transmitted diseases surveillance 2016 of the U.S. Department of Health and Human Services Centers for Disease Control and Prevention. Ayan. So, sa chlamydia, ano nga ba pag sinabi natin chlamydia? Ang chlamydia po ay isang uri ng sakit na nakukuha sa pakikipagtalik ng nasanhi ng infectiong bacteria. Lumalabas ang sakit na ito mula 7 hanggang 20 days pagkatapos mahawa. Yung chlamydia po is kilala po yan sa tawag na tulo. Sa Tagalog ay tulo. Ayan. In 2016, a total of 1,598,354 cases of chlamydia trachomatis infection were reported to the Centers for Disease Control and Prevention. So, yan po ay surveillance ng US Department of Health and Human Services Centers 2 for Disease Control and Prevention. Yan. Imagine niyo po, ganun po kadami yung nagkaroon ng case ng sakit na chlamydia, making it the most common notifiable condition in the US. Rates of chlamydia are highest among adolescent and young adult females, the population targeted for routine chlamydia screening. So, next slide po. So, gonorrhea. Ano ba pag sinabi natin gonorrhea? Ang gonorrhea po ay isang bacterial infection. Ang gonorrhea po ay kilala rin sa tawag na daklak at drip. Kaya tinatawag itong tulo ng mga Pinoy. Ayan, para din po siyang chlamydia. Sabi po ng mga eksperto mula sa Mayo Clinic, sanhi ito ng bacterium na Neisseria gonorrhea. Ayan. So, in 2016 po, base sa surveillance ng US, 27,000 2,614 primary and secondary or P and S syphilis cases, dito pala sa gonorrhea. In 2016, 468 gonorrhea cases were reported for a rate of 145.8 cases per 100,000 population. Ayan po. Makita niyo naman po sa picture na yun po yung infection. Yung peak pong yan is isang penis ng lalaki. Ayan. The magnitude of the increase among men suggests either increased transmission or increased case ascertainment throughout increased extragenital screening among MSM men who have sex with men or both. Ayan. During 2012 to 2016, rates increased among all racial and ethnic group. Ayan. Nakipag-sex po yung lalaki sa lalaki at yun po yung naging cause ng sakit na yan. So, syphilis. Ano nga ba pag sinabi natin syphilis? Isang infection na nakukuha sa sexual STI na sanhi ng isang uri ng bacteria na kilala bilang Treponema pallidum. So, ayan. Base din po ulit sa surveillance ng US. In 2016, 27,614 primary and secondary P&S syphilis cases were reported, representing a national rate of 8.7 cases per 100,000 population and a 17.6% increase from 2015 during 2012 to 2016. P&S syphilis rates were consistently highest among persons aged 20 to 29 years old, but rates increased in every 5-year age group among those aged 15 to 64 years. Ayan po. Next slide po. Ayan. Chancroid. Ano nga ba pag sinabi natin chancroid? Isang bacterial infection na nagiging sanhi ng bukas ng mga sugat sa paligid ng maselang bahagi ng katawan ng mga kalalakihan at kababaihan. And pwede rin po siya sa mga sa muka o yung sa labi. Yan, makikita niyo po sa picture. Yan po yung naging sanhi ng sakit. Ayan. So, chancroid reported cases of chancroid declined steadily between 1987 and 2001. Since then, the number of reported cases has fluctuated somewhat while still overall. In 2016, a total of 7 cases of chancroid were reported in the US. So, kaunti lang po yung naging case ng sakit na chancroid sa US. So, ano naman yung human papillomavirus? Ang human papillomavirus ay isang nagdudulot ng karaniwang mga butigin. Ang maliit, puti, murang kayumanggi o brown na paglaki ng balat na maaring dumitaw halos kahit saan sa parte ng ating katawan. Ayan. So, human papillomavirus is the most commonly sexually transmitted infection in the US or United States. Over 40 distinct HPV types can infect the genital tract, although most infections are asymptomatic and appear to resolve spontaneously within a few years. Persistent infection with some HPV types can cause cancer and genital warts. Ayan. Yung HPV po or human papillomavirus ay maaari din po mag-cause ng cancer and genital warts. No. So, next slide po. Herpes simplex virus. Ano ba yung herpes simplex virus? Is among the most prevalent of sexually transmitted infections, although most infections are subclinical. Clinical manifestations are characterized by recurrent, painful, and or anal lesions. Most genital HSV infections in the United States are caused by HSV type 2. So, may dalawa pong uri ng sakit na yan, ang HSV. HSV2, while type 1 HSV1 infections are typically oral labial and acquired during childhood. So, ayan. Kilala rin po ang herpes simplex virus yun nga po sa HSV. Isang infection po na nagdudulot ng herpes maaring lumitaw po sa iba't ibang part ng katawan na kadalasan po nasa mga masailang bahagi ng katawan. Yan po, pati rin po sa bibig ng tao. Trichomonas vaginalis. Yan, para lang po yan sa mga babae. Kasi vaginalis po. Isang sakit na nakukuha sa pagtatalik or STD, dulot ng isang microscopiko na isang selula. Maaaring maging sanhi po ng mga infection sa vaginal at pamamaga po ng urethra. Yan. Trichomonas vaginalis is a common sexually transmitted transmitted protozoal infection associated with adverse health outcomes such a preterm birth and symptomatic vaginitis. Visits for Trichomonas vaginitis infection in 2015 was 139,000. Ayan. So, yung mga sakit pong yan is may mga symptoms. Okay. Ano bang symptoms ng chlamydia? Yung una po natin binanggit. Sa babae po, bleeding between periods, pain during sex, bleeding after sex. Ayan. Sa lalaki naman po, pain when urinating, yung umiihi po, pain in the testicles. Sa gonorrhea naman po, sa lalaki, painful urination. Parang ganun din po sa symptoms sa chlamydia. Pain or swelling in one testicle. Sa babae naman po, increased vaginal discharge, abdominal or pelvic. Sa syphilis naman po, sa sakit na syphilis, sa babae po, white patches in the mouth, flu-like symptoms such tiredness, headache, joint pains. Sa lalaki naman po, mild fever, fatigue, sore throat, muscle pains. So sa chancroid naman po, sa lalaki, yung symptoms, notice a small red bump on their genitals. Sa babae naman po, develop or more red bumps on the labia, between the labia and anus. Ayan. Sa human papillomavirus naman po, ay yung symptoms, common warts, plantar warts, flat warts. So, ayan po yung mga halimbawa ng mga symptoms sa nabanggit pong sakit na STDs or sexually transmitted diseases. Yun lamang po at maraming salamat.
Good afternoon, everyone. My name is Alexis Abuyan, and the topic that was assigned to me is the natural and artificial method of contraception. But before we start, what is contraception? Contraception aims to prevent pregnancy. We have 18 ways of contraception, and it was divided into two kinds, which is the natural and artificial method. Natural method po do not involve any chemical or foreign body introduction into the human body. So it means po, hindi po dito gumagamit ng chemical or any injections para po ma-prevent yung pregnancy. Natural na pamamaraan lamang po para hindi mabuntis. Next slide po. So the first one, under the natural method, is the abstinence. Abstinence involves retraining from sexual intercourse, and it is the most effective natural birth control with ideally 0% failure rate. It is considered to be most effective way to avoid STDs or sexually STIs or the sexually transmitted infections. So abstinence po is avoiding sexual intercourse with anyone. Abstinence po means absence. It was 0% fail rate po kasi wala pong sex na maganap or hindi po nakikipag-sex. Most people find it difficult to comply, so only few use this method. So next po, we have the calendar method. It is also called as the rhythm method. The woman needs to record her menstrual cycle for 6 months in order to calculate the woman's safe days to prevent conception. Calendar method po is called rhythm method po because you are going to log the rhythm of your menstruation. So we have our sample calendar here. So as you can see po, sa first week po, it is the menstruation week po, followed po ng fertility. Ano pong ibig sabihin nun? Means po, after na menstruation, you should avoid coitus. Ang coitus po means sexual intercourse. Kasi fertile ka, hindi safe ang makipag-sex. It takes 2 weeks na fertile and infertile na sa last weeks hanggang sa magka-menstruation na ulit. So the third one po is the basal body temperature or the BBT. It indicates the woman's temperature at rest. A slight decrease in the basal temperature followed a gradual decrease in the basal temperature followed by gradual increase in the basal body temperature can be a sign that the woman is ovulated. Dito naman po, i-record naman po ng babae ang kanyang temperature every morning bago po siya gumawa ng kahit anong activity. Kapag bumaba ang temperature and gradually increase, it is a sign na ang babae ovulated. Ano po ang ovulated? Ovulated po is releasing an egg from your ovary to your fallopian tube. Ibig sabihin nun ay fertile ang isang babae. Next slide po. Next po is the cervical mucus method. The change in the cervical mucus during the ovulation is the basis for this method. The woman is said to be fertile as long as the cervical mucus is copious and watery. Therefore, she must avoid coitus during those days and prevent conception. Ang pinagbabasehan naman po dito ay ang pagbabago ng mucus ng babae during ovulation. Ang babae daw po ay fertile kapag ang mucus ay copious and watery. Ibig sabihin, need to avoid coitus during those days to prevent conception. We have our sample photo here. Kita po dyan, ang iba't ibang type ng cervical mucus or gel-like discharge from the cervix. So kapag po dry or thick, safe po tayong mag-coitus. Pag naman po sticky, safe pa din po. And kapag po creamy, we need to avoid it. Why po? Because women are semi-fertile na and it was unsafe to do coitus. And last po is the clear. Under na po ito ng watery and slippery means po fertile ang isang babae. Next one po is the sympothermal method. Ang sympothermal method po is a combination of BBT method and the cervical mucus method. The woman records her temperature every morning and also take note of the changes in her cervical mucus. Combination po ito ng BBT at cervical mucus. Dito naman po, habang nire-record ng babae ang kanyang temperature, sinasabay niya din po ang pag-check ng kanyang mucus to know if there are changes into her body. Fertility awareness nga po, para po ma-prevent ang pregnancy. Next slide po. Next po is the ovulation detection. Ovulation detection uses an over-the-counter kit that requires urine sample of the woman. This kit can predict ovulation through the surge of luteinizing hormone or LH that happens 12 to 24 hours before ovulation. So we have our sample photo here. Yan po ay ginagamit para ma-detect po ang ating ovulation period. Ngayon po, meron na po tayong mga application sa Play Store para po hindi na po natin kailangan bumili ng ganitong kit. Doon naman po sa mga app sa Play Store po yun, pwede po natin dong ilag or i-note po yung mga nangyayaring changes sa katawan natin para po malaman po natin kung tayo ay fertile o hindi. Then the last one po under po ng natural method is the coitus interruptus. Coitus interruptus is one of the oldest methods that prevent contraception. A couple still goes on with coitus, but the man withdraw the moment he ejaculates to emit the spermicide outside the female reproductive organ. So, ang coitus interruptus po, ito po yung tinatawag nating withdrawal method. It has disadvantage po kasi po, kagaya po ng pre-ejaculation fluid, during the coitus, hindi po ito makocontain o mapipigilan ng lalaki, kaya may ilabas pa din po sa loob ng genitals ng babae which may cause fertilization. Next po. So, those are the 7 natural ways of contraception. Next po, we have artificial method. Artificial method po is, dito na po papasok yung paggamit ng injections, pills, para po hindi tayo mabuntis or para po sa birth control. So, ang pinakauna po sa ating artificial method ay ang oral contraceptives. Oral contraceptives, also known as pill. Oral contraceptives contain synthetic estrogen and progesterone. So, dito po sa oral contraceptives, women are suggested to take the first pill in every first Sunday after the beginning of their menstrual flow or as soon as it is prescribed by the doctor. Take note po, hindi po tayo pwedeng uminom ng pill kasi po sinabi lang ng kaibigan natin. Dapat po ay prescribe po ito ng doktor kasi po it may lead to overdose kung hindi naman po tayo nagpa-check up before tayo mag-take ng ganito. So, next po is the transdermal patch. Transdermal patch, it contains both estrogen and progesterone. The woman should apply one patch every week for 3 weeks on the following areas: upper outer arm, upper torso, abdomen, or buttocks. The area where patch is applied should be clean, dry, and free from irritation. So, transdermal patch po is a patch that contains medication. It is attached underneath our skin. A patch may be more comfortable po para sa atin kung nagtitake po tayo ng medication. Next slide po. The third one po is the vaginal ring. Vaginal ring is inserted into the female reproductive organ and remains there for 3 weeks and then removed on the 4th week as menstrual flow would occur. The woman become fertile as soon as the ring is removed. So, vaginal ring po works by trapping vaginal rings po work by stopping our ovaries from releasing an egg every month. This help po to prevent the sperm from entering our cervix. Next po is the subdermal implants. Subdermal implants are 2 rod-like implants inserted under the skin of the female under her menses or the 7th day of her menstruation to make sure that she will not get pregnant. So, subdermal implant po is a birth control implant in size of a matchstick. Kasize lang po siya ng posporo. The implant releases hormones into your body that prevent you from getting pregnant. A nurse or doctor should insert this into your arm and that's it. You're protected from pregnancy for up to 5 years. It's a get it and forget it control. Next slide po. Next po is the chemical barriers. Chemical barriers such as spermicides, vaginal gels and creams, and glycerin films are used to cause death of sperms before they can enter the cervix and to the lower pH level of the female reproductive organ, so it will not become conductive for the sperm. So, chemical barriers po, these are those creams and gels po that is placed to the vagina before the couple takes a sexual intercourse. These contraceptives provide a chemical barrier to sperm by trapping and damaging the sperm and also prevent the sperm from fertilizing the egg. Next po is the diaphragm. Diaphragm is a circular rubber disc that fits the cervix and should be placed before coitus. Diaphragm po is inserted by a physician 6 hours before the coitus or the sexual intercourse. It covers the cervix so the sperm cannot get into the womb or the uterus to fertilize an egg. Next po is the cervical cap, made of soft rubber and fitted on the rim of the cervix. So cervical cap po is a birth control device that prevents sperm from entering. Parang kapares lang po siya ng diaphragm po. Next slide po. So third to the last po, male condoms. Male condoms po, ito po yung pinaka-common sa ating artificial method. Male condoms is a latex or synthetic rubber sheet that is placed on the erect part of the male reproductive organ before penetration into the female reproductive organ to trap the sperm during ejaculation. Next po is the female condoms. Female condoms is made up of latex rubber sheets that is pre-lubricated with sperm side. So female condoms po is outer ring is the first inserted against the opening of the vagina and the inner ring covers the cervix to prevent the sperm from entering and to fertilize the egg. Last one po is the surgical method. Surgical methods in males, a small incision is made on each side of the scrotum. The vas deferens is then tied, cauterized, or cut or plugged to block the passage of the sperm. In women, tubal ligation is performed during menstruation and before ovulation. So, sa lalaki po, under po ng surgical method, ang tawag po ay vasectomy. Vasectomy po is cutting or tying the vas deferens para po hindi po makapaglabas or mablock po yung passage ng sperm ng lalaki. So sa babae naman po, ang tawag naman po sa babae sa surgical method po is the tubal ligation. Tubal ligation po is yung fallopian tube po yung fallopian tube po natin is itatay para po di po makapasok ang ating egg cell sa ating uterus. So those are the natural and artificial method of contraception po.
That's all po for our report. Thank you for listening. Once again, I'm Pia Magding Lacarte with my co-members, Alexis Abuyan, Kervin Gono, Don Christopher Baet, Eugene Alfonso Lirado, and Carl Brian Pabul. And we are from Montreal. Thank you po. Bakas na.